The Tom Anderson Show, broadcasting live from the KVNT studios, 7 to 9 a.m., Monday through Friday.
Well, Dr. Ann Zink is the Chief Medical Officer for the state of Alaska, MD, under Governor Mike Dunleavy's administration and working with Adam Crum, who, congratulations to him with baby girl, I heard this week. He's the Commissioner of Health and Social Services. And on Tuesday, Alaska becomes the first state in the nation to make COVID-19 vaccinations available to anyone over the age of 16, basically who live or work here. And Governor Dunleavy said that's a game changer. So folks, we're looking at Pfizer vaccines available to people who are 16 or older, and then you've got Johnson & Johnson and Moderna vaccinations to people over 18. All three of those shots have shown to be effective, like preventing severe illnesses, hospitalization, death because of COVID-19. Dr. Zink, that is so huge, and it's the first time you and I have spoken, and it's such an honor to have you with us. Endearing positive headlines, that's what Alaska needs more of, and you really brought that to the nation. Thank you for that. High five through the phone.
High five right back at you. It's great to be here, and it is super exciting to put this pandemic behind us and move this really, truly to a preventable disease. So really excited to have vaccine across the state and moving forward.
I wish there was a local, the TV show Biography where they say, Thomas Jefferson did this and Oprah Winfrey did this and Michelle Obama or Donald Trump or whomever. I wish they did one on you, and I would love to see daily what you go through. And my guess is you rarely sleep, and I know you have a family and you have an outdoor life, and I dig that about you. You're a real person, which is cool. But you also have a very busy job. And is your day just difficult to explain because you're on the phone so much or talking with people?
Yeah, it's been a whirlwind for sure. It's a real honor and a privilege to have this job. I get to talk with Alaskans across the state, hear their questions and concerns. I work with an amazing team within DHSS and within the administration. I also practice as an emergency physician in the Valley, and that is just great to continue to have the chance to just talk to patients one-on-one. But every day is a new day. My dad always told me to find a job where I was always learning, and I told him, no worries.
Yeah, well, you're doing that for sure. And yep, I know that you're out here. I live in the Valley and have heard nothing but good things about you. When you were chosen for that way back when, I have an ad agency, and a lot of our clients, medical providers, were like, "Oh my gosh, she's a rock star." And I want to get into some of this with your celebrity and your success. There are still things out there when we look at like statistics. Federal statistics project like I was reading over 500,000, 520 million, I think it said through NPR. Have died from COVID-19, but then there's this growing response to that data, especially on the conservative side, that say, wait a minute, there's like a sizable portion of those folks that sadly died that were like already knocking at death's door. Maybe they had a chronic illness or super old or late stage cancer. Do you ever reconcile like those perceptions as a practitioner when it comes to COVID-19 policies with the numbers, or are you saying, hey, we want to prevent it, we're trying to look at the best way to get people safely through it, and I'm not going to debate if someone died with partial cancer, partial COVID, or is that relevant in your policy making?
Yeah, no, I think it's important that we're completely transparent with the data and that we answer people's questions. The reality is we are complex human beings, and when people have underlying health conditions, they're at more risk for all sorts of things. They're at higher risk from dying from a rib fracture if they fall, as they're a higher likelihood of dying from COVID. So there are many things that play into it. The younger you are, the healthier you are, the more your underlying health conditions are managed, the better people do. And so that's why it's so important to eat well, to exercise, to stay connected mentally and physically strong. That being said, COVID's real, and COVID has been killing people, young and old. And it's really heartbreaking to see firsthand, healthy 40-year-old guy saying, I just thought this was the flu, struggling to breathe, not able to get enough oxygen. We report COVID deaths like we do any other death. It's the same process we use as the flu, as heart disease. We rely on clinical judgment and what clinicians fill out on the death certificate. That gets reported back to the state in the death certificate review process. And we look at those numbers in multiple ways, and we also look at other data. So it's not just the deaths, but we look at things like ILI or influenza-like illness. How many people are showing up to the emergency department and hospital with cough or fever? We also look at excess deaths. How many more people are dying each month compared to the same time last year? And that helps us to understand how much more of a disease we may be having circulating. And then we try to look down and break down. And every way you look at that data, COVID's real. COVID's been killing people. COVID's been resulting in people being hospitalized. I think the other telling fact for me is just, as soon as the vaccine was available, every single physician at Massey Regional who works in the hospital and sees patients regularly for COVID, the hospitalists, the ICU docs, emergency physicians, all chose to get vaccinated. When you see this disease and what it can do up front, it's humbling and it's scary. And to have an effective vaccine to prevent severe illness and death is just fantastic, and encourage anyone to get it.
NPR reports, and we're talking with Dr. Ann Zink, Chief Medical Officer for the great state of Alaska, and NPR reporting that as of Tuesday morning, more than 123 million vaccine doses had been distributed to all 50 states. More than 93.6 million shots had been administered. Now, Governor Dunleavy says, hey, I want to, and no doubt conferring with you, I want to open it up 16 and older. Alaska, NPR reports, has received 288,000 vaccines. That might have gone up over the last couple of days, and has vaccinated 170,993 people. The numbers are really staggering how well you've died. Yet the death rate, sadly, 301 have died from COVID-19. 57,304 in Alaska have contracted the coronavirus. Those numbers, while they sound high, it's really a testament to your leadership and the governors and your team. How did you decide Tuesday, and when did you decide, because I'm sure it was before Tuesday with the announcement that everybody would get the vaccination, you'd be the first in the state, in the nation, to do this here in Alaska? How did you come to decide that, and when?
Yeah, we've been looking at our tiers as we move forward. We knew after we opened up the last tier, which was essentially anyone 16 and above who had any underlying health conditions or worked in critical infrastructure, that our next tier would be to have everyone open. So we knew it was coming. We looked at the appointments that were online. We spoke to our communities. And interestingly, many of our communities, we get monthly allocations for the vaccine. So many of our communities asked us to open up sooner rather than later because they put together big pods at the beginning of the month. Because really, we're in a race against time against these variants, and these vaccines work very well against the variants. We're in a race against time before industry partners start to come in, fishing, tourism. We want our economy open. We want people here. We want people gathering. We want kids in school. And vaccines is the way that we move there as quick as possible. So looking at all of that, we knew we needed to move quickly. We had been actually planning for the following week, and actually the day we opened it, we were looking more at our data. We received some very specific feedback about pods that were happening that weekend, and I think one of the things I love about our team is we can pivot quickly. So we had a conversation with the governor that day, and we're like, let's do it tonight. Let's just make it happen. And So we asked the call team if they could stay late. They said, sure, we'll stay late. We'll answer phone calls. We put together the press conference. That decision was actually made earlier that morning. We knew it was going to happen, but we weren't quite thinking that day. But we were like, man, it's time. We got to go. So we pivoted and moved.
I looked it up, Dr. Ann Zink, and your connection to Alaska and what you're doing in your position, and the national news coverage is like off the charts, from Reuters to NPR to Fox to CNN. It's like, good Lord. Now, here's a big question, $1 million question. What's the best vaccine? Is there one you prefer? And will people be able to choose, or is it dependent on like your, if you're an Alaska Native or a veteran or private insured or Medicare or Medicaid? Are you just going to say get it wherever you can get it, or do you have a preference?
Yeah, well, I am going to say the best vaccine is the one you can get. So all three work well at preventing severe illness and death, which is the goal. And all three looks like they work fairly well from what we can see against the variants. So whichever one. However, we understand that Alaskans want choices. And as a result, we are distributing all three vaccines across the state to all regions. So there isn't as much Johnson & Johnson vaccine in the state as of yet, just because it just became approved. The Pfizer is the only one that can be used for 16 and 17-year-olds because it's the only one that's currently been studied down to that age group. So for 16 and 17-year-olds, Pfizer is the only choice. So from a data perspective, they're all great, and I would encourage people to take whichever one. But people have their preferences for all sorts of reasons. Sometimes people don't like needles, and they just want one shot, and they can just get the Johnson & Johnson. Sometimes a clinic is near them. Many of the clinics offer multiple different options. Sometimes they'll do it on different days just to make it logistically easier. And our website tells you which vaccines are being offered at different sites, so you can choose.
That's right. Dr. Ann Zink, I look forward to getting you back again. She mentioned the website, dhss.alaska.gov. Keep up the good work, my friend. We look forward to hearing about the progress in coming weeks, okay?
Awesome. Thanks for having me, and happy vaccinating.
You betcha. Thank you. That's Dr. Ann Zink, Chief Medical Officer for the great state of Alaska, Tuesday announcing that everybody can get a vaccination. First state to do this in the nation. Stay with us. Tom Anderson Show.